European Atherosclerosis Society Congress will start tomorrow. We have the privilege to present an oral poster about statin and aspirin in primary prevention from a database, a collaboration between Argentina and Sebastian Garcia-Zamora and the College of French Cardiologists. More than 500 patients were consecutively enrolled. We observed that in intermediate and high-risk patients in primary prevention, less than 1/4 of patients received statins, whereas aspirin was prescribed in more than 22% of patients, and other antiplatelet agents were prescribed in 5% of patients. So we will discuss this data in European Atherosclerosis Society Congress in Lyon in a few days. Stay tuned.